welcome to the podcast. And today, this podcast is one of the favorite, one of the most inspiring, and one of the podcasts that I am really grateful for each day. He is someone, when we entered to the dentistry, I saw him and I was like, how can dentist be such an amazing doctor? And he made sure to change each and everyone's life with his work. And even today, I'm following his footsteps. I'm following how he has done all the cases, how he is just being amazing day by day. And when we used to attend his workshop, there is not a single dentist who will come like, okay, it's a regular. No, we all are surprised each and every day. So this podcast is personally one of the favorite, one of the grateful for me. So please welcome Dr. Ali, who has actually explained us what dentistry is. And more than a dentistry, I always wanted to know about the personal journey. And I have seen that we always see the success, but we never see the journey that they have behind it. So today, I made sure that each and every dentist can go through his journey. And if you are somewhere lacking on that point, so please understand we are not alone. They have been through, but they are the inspiration to come through it. So let's understand and let's listen to him and get the best out of it. So, hello, sir. A
Hello.
very good morning. And first of all, thank you so much for giving your time and making this podcast a highlight because I think every one of us, like all the dentists, especially, are like very much they are seeing you, your work, how you have grown. But today in this podcast, I don't want to just talk about the cases or everything because somewhere we have our own way.
Yeah.
But today I want to talk the growth of here. How did you reach here? How did you did all the struggles, your journey especially, and I'm very sure each one of us will be very much like they want to know how we do. So, as a young dentist, I'm here to represent all of us. So, your first, we'll start with a very basic thing. And as I'm already in your clinic and I'm loving it, so I want to ask that if any patient comes to you and what is the first thing you notice, like in 30 seconds, even before you see their oral health, what do you see about them?
So generally, the patient when they enter the practice, they first interact with the front desk. So that was some part of our practice which was really lacking because we realized that in India we learn dentistry, but we don't learn all the allied subjects that have to go along with dentistry, like front desk management and patient management, all those aspects, the soft skills they are called. So the patient usually comes into the practice and interacts with the front desk receptionist and the clinical staff. They usually talk to them a few questions about their medical history and why they have come and how they have heard about us, and get initiation with the conversation. And we realize that many of our patients come from very far. Some of them sometimes are coming, taking a flight and reaching here. So we don't rush them into getting them into the operatory. We give them enough time to maybe sit down, have a conversation, have a cup of water or have some tea, coffee, see that they've had breakfast, ask them if they need to just sit and catch their breath, and allow them to feel comfortable. And once they're comfortable, then our staff arranges them. So we quickly do a examination, and then from there onwards, the data collection starts based on their chief complaints and what are the things we observe and how we need to solve them. But in the first 30 seconds, I usually judge a patient on his punctuality, whether he is really going to make it on time or whether I'm going to have a problem with that. Because in that case, then I need to structure more time because some of our procedures are longer. And basically, it all depends on how apologetic the patient is once they reach. If they reach and late for an appointment, and it's like a matter of fact thing, then we need to somewhere tell them during the process that if they come late, then their time from our appointment is taken away. So whatever we have planned on that day, next time will not happen. We don't do it in a rude manner, but we make the point very clear to them. Having said that, we know we are in Bombay and traffic can be a little erratic at times. So we always allow that to be a factor. If the patient is coming, let's say, from the eastern suburbs, and we know crossing from east to west is a problem. So we factor a little bit more time, and the patient usually enters in a hustle and says, I'm so sorry, I just got stuck in traffic. I had left on time but couldn't reach. So we understand that. But we factor that in our appointment because I like to have my day very structured. So if there is a 1 hour delay in a patient reaching the practice, my entire setup goes wrong for the day. And so it's not fair to the next patient who's going to reach on time that he has to wait. So we generally have a no waiting period policy in our practice. We try to stick with that as much as we can. So yeah, I'm just judging them for their punctuality more than anything else at that point. Yeah.
I think here I got late for like 10 minutes.
No, that's okay
But
because you're anyway supposed to come early later on today, and we prepone the appointment, so
yes,
it's fine. And of course, coming for the first time, patients also have a problem searching the place.
yeah,
They don't imagine the clinic to be inside a commercial building on the seventh floor.
yes,
Plus, they have to figure out the parking. So all those factors we keep 1 hour for a first checkup appointment, half an hour for the delay and half an hour for the work. And that's how our city is. We have to
actually
factor that in.
that's the truth and
Yeah.
that's the reality.
Yeah.
Because I think each and every clinic should keep this so that the next patient is also not disturbed and
Yeah.
even your day is not disturbed.
Absolutely.
So that's true. But as you told that your whole day is structured, I want to know that what's your morning routine? What's the morning routine you have built up in all these years?
So I generally uh, we need to work out to keep our body fit. So when I wake up, I usually have some workout session, either a gym trainer or sometimes yoga. I like to take long walks by the seaside, and that's easily accessible to us everywhere. So I do that as much as I can before 8 o'clock, and then I have a light breakfast, and I come here. Usually, I'm at the clinic by 9. I reach before everybody else reaches, so I read up a little bit, see what are the various sciences which I need to get touch base with. So I like to read that half an hour, 45 minutes before everybody comes and starts to talk to me. And usually our first patients are from 10 onwards. So then, depending on the time and the procedures, the time is slotted. I usually like to finish by 5:36, so I can be home by 6:15. Luckily, I stay very close, and then I have the evening to myself to either watch something or read something non-dental, or again go for a walk, spend time with the family. So I like to keep all my compartments uh, completely secure as far as time is concerned. And if we don't value our time, our patients will not, and that becomes a bad habit in the long term.
Yes,
Okay.
that's true.
Yeah.
I have heard somewhere that if you value your time, you have gained the respect.
Right.
So that's really true. And somewhere I don't know, whenever I see your stories, so always I've seen that something is there at 10 a.m. or 11 a.m.
Right.
And there I understood that you are already in clinic because many of us start day at 10 a.m. or 11
Yeah.
a.m. So that's the great thing actually that you I have seen in you. Uh, but here, like we have seen that you do a lot of FMR cases.
Yeah.
So I want to ask that if any FMR case came that is very complex,
Hmm.
so how do you plan those cases?
Right.
Because sometimes patient only tell that no, I want FMR, I don't want denture or I don't want any other thing. I want to go with a fixed thing.
Right.
And we also prefer the fixed thing. So how do you plan? What are the things that you take care of?
So That's a very long answer to that question. I'll try to make it short because the modern dentistry is all about planning.
Yes.
And so we spend a lot of time doing a detailed analysis of the existing condition of the teeth. We of course ask the patient what they want and try to cater to that. But somewhere down the line, patients don't know much.
Yeah.
They don't know what they want.
Yeah.
It's like uh, you never knew that you want your next phone.
Correct.
But when you get the phone and you see the technology, you realize that, oh, this is what I was missing. The screen is much better. I can navigate much better. My speed has increased. The calls are able to be more audible. And so you realize what you were missing when you get the new item. So the patients don't know what they are missing, because especially in country like ours, usually patients come to us when it's too late, when the pain is too much or too many teeth are lost, or sometimes they've gone to their local dentist and their case has been not comprehensively managed. So the first thing I do is take the data and help the patient understand where their existing dentition is and where the ideal dentition should be. So they should understand where they should be after they finish the treatment. That vision which I have, they have to understand that. And once they understand and I'm able to explain them with pictures or with cases, then usually they will ask, how do I get here? And so there starts my roadmap. And so the roadmap starts with the first appointment is all about data collection. So we take a series of around 18 to 20 pictures, starting from the full face to the macro anatomy of the teeth. Then we take all the dynamic data in form of intraoral scans, CBT, CT scans, whatever is required. Then we chart out everything that has to be done for every tooth from a biomechanical or caries perspective. We chart out what needs to be done from a perio perspective so that the foundations can be strong. And we chart out what needs to be done from a point of view of implant dentistry. Many patients require a full mouth rehab, but in that they require one or two implants. So that has to be structured in. And sometimes patients require 10 to 12 implants, but there are 3 or 4 teeth which need to be saved. Yeah. Because that is what the plan is. So then when the plan is being made, the biggest factor is to consider how much time the patient will be able to give you, apart from how motivated he is. And we are a referral based practice. So most patients who come to us are highly motivated to take stock of their existing poor dental condition and take it to a very good level. So we are lucky in that regard. And when we talk to these patients, we ask them what their schedules are like. Are they salaried employees, or are they owners of some company, or they have freedom in their time? So based on that, then we decide how many sittings that would be requiring, how many times they'll have to come. And the biggest asset our practice has is we are able to pinpoint to the patient the exact number of sittings they'll have to be with us, and how many hours each sitting will require.
Is this in your first consultation only?
You know, usually it happens in the second consultation. The first consultation is all the data collection and assimilation. Yeah. But yes, I have everything in house. So if the patient says that I'll wait for some time, if you can give me a plan, then if I have the time, I would do the plan on the same day and give them an idea. And so we would structure the appointments, the duration between the appointments, and the duration of each appointment. Because we've realized that patients who value good dental treatment and are able to afford it usually don't have the time to keep coming for small jobs. So when they come to us, sometimes in the whole day, we just have one patient scheduled for 5 hours. We don't need anything else on that day. So the normal OPD keeps going on. Pain related things happen in the practice. We have a team of doctors with us. So that happens. But our main crux then on that day is that patient, and see that whatever we have promised him, we do that in the most efficient manner. And then he should be able to go to work next day if he desires to. And if he has expressed that desire, then what are the red flags in that we have to communicate? Sometimes we tell them, okay, you might have a swelling the next day, so you may not want to have a very big social commitment in the next few days. Sometimes we know that, okay, the appointment is long, but next day you're not going to have any problems. You can go ahead with your life without any issue. So that communication for high value patients is very important.
Yeah, that's true. And when they get the clear picture, so patient also get very transparent,
Yeah,
and they get clear, and then they allow themselves,
yeah,
and they give themselves to you.
yeah,
Okay, now I am in your hand.
yeah,
Do however you want to do
yeah.
it.
That's how it should be.
Yes, and that's really true. But in as I'm studying implant and I'm trying to focus on it and I'm trying to do my best,
Yeah.
but what we have seen that implant is always about restoring,
Hmm.
like, and we restore the teeth and everything. But gradually, when I study about implants a lot, and then I study about FMRs, then I understood that it's not just restoring thing. It's biology, it's function,
Yeah,
it's systematic,
yeah,
it's conservative, and main important is aesthetic,
right,
because patient needs all this, but first priority for them come aesthetic.
yeah,
So how do you manage and how do you train yourself
right.
that we have to take care of all of this and give treatment to the patient?
So, aesthetics is something at the forefront. Every dentist, every restorative dentist or general practitioner
Mm.
needs to spend a dedicated amount of time mastering the subject of aesthetic dentistry.
Mm.
And luckily for us, aesthetic dentistry is not a separate subject. It's
Mm.
something which belongs to many other subjects.
Correct.
And it's what binds perio with prostho, with ortho, and with surgery. And so, if you are not good with aesthetic dentistry, you will always struggle knowing where to put the teeth on the patient's face.
Correct.
And then you will end up making teeth too procline, too retrocline, too long, too short, too wide,
Mm.
and you will not meet the requirements. So, for me, luckily, what happened after masters in GDC, I did prosthetic dentistry, and then I was not satisfied with the way I was working because uh, sometimes my work was good, sometimes it was not good. It was inconsistent, and I realized that
Mm.
I need to hone my skills in other subjects. And we had a study club of a few friends of ours in which I stumbled upon the Journal of Cosmetic Dentistry,
Okay.
which is the publication of the American Academy of Cosmetic Dentistry. And when I read those articles, I realized that that is the level of the work that I want to be able to do.
Mm.
And so I logged into the website and I saw that there is something known as credentialing. You can become an accredited member of
Mm.
the AACD. So I just blindly enrolled into it. I went into the written test and I passed it. And then I realized that now I've put myself into a situation where the subject which I have to deal with is very, very complex, and I don't have the tools to get those skills.
Get
So I needed the
those.
training and I needed the tools. And my practice was young. I did not have any disposable income. But luckily, we managed that slowly, slowly over a period of time. There is 5 years time you get to do the AACD
Mm.
credentialing. So I took all of 5 years because the first 2 years I was just buying. I had to buy the SLR camera, and their requirements for the camera were very stringent. So at that time, this was around 2006, 20 years ago.
Mm.
To buy a DSLR camera was
Was
very
very,
expensive.
yeah,
It was a lakh of rupees, but lakh of rupees was a lot of money at that time.
money, yes.
But somehow I acquired that, and then there was nobody to teach. So I went to some senior dentists who
Mm.
knew the pathway, and so
Mm.
I learned the basics. And then AACD trains you very well. So every year you have to attend their conferences, and I learned a lot from there. I learned how to uh, have a very structured photography protocol in my
Okay.
day-to-day work,
Okay.
and that is what helped me get all the work that I'm doing even now. That was the
Mm.
foundation for it. And once I mastered photography, then I started looking at my work on a big screen. And I realized that everything that was looking so beautiful in the mouth looks horrible. There is excess resin around the veneer. The
Yes.
gums are a little inflamed. The
Yes.
composite, which I thought I had polished very well, was full of scratches. The reflections were not coming well. So then I realized that I don't think I'll be able to do the AACD accreditation, and I was almost about to give up. But then I
Mm.
went in 2009, they had a conference in Hawaii,
Mm.
which was, I think, more or less the turning point of my life because the way I got trained in those 6 days over there in AACD, I came back and completely supercharged. And then in 3 years, I finished all the 5 cases.
Wow.
So that training which I got, the mentorship that I got from AACD, was actually what honed my skills. Otherwise, when I did my master's here and I came out, it was very raw and unstructured. And what I was reading in the books was not what I was able to do in the practice.
Practice.
Yeah. So that's where aesthetic dentistry came into the picture.
Wow, that's really great. And now your pictures, like your cases,
Yeah.
pictures are like wonderful. Like
Yeah.
it's
But now it's
really
second nature.
something.
It's not very difficult to get. I said I take 18, 20 pictures for a patient, and I generally take around 10 to 15 minutes to take them.
Can you just tell me in short that what's that 18-20 pictures are that?
So we start with the full face
Okay.
in full smile.
Okay.
That is what tells you where the teeth are on the patient's face in the existing condition.
Hmm.
Then we go closer and make the patient smile completely, and take only the smile picture with the lips
Okay.
and the teeth. So
Okay.
that is a front and lateral views. So that's 4 pictures. Then you retract the lips,
Yeah.
and you see the intraoral retracted view of all the teeth.
Hmm.
That's, we call it the 1:2 view,
Hmm.
and that is front side in
Hmm.
MIP.
Hmm.
So that's 7 pictures.
Hmm.
Then you go macro on the teeth, on the upper anterior teeth, and you
Okay.
take front side. So that's 10 pictures.
Hmm.
Then upper occlusal view, lower occlusal view. These are the 12
12
pictures.
pictures.
Then we take some pictures with the patient's lips at rest
Hmm.
and when they are talking.
Okay.
So that's when they say sounds like shush.
Yeah.
So we can see the lower anterior teeth
Yes,
also. So that's around 14 pictures.
yes.
And then I take some protrusive and right and left lateral pictures just to add to the
The
occlusal aspects of that.
occlusal.
So these are the pictures which are generally taken and they are required in the lab for planning. Without them, I cannot work. So I generally create the entire patient's profile in the absence of the patient. So then I can look at everything the way I want to.
Yeah.
And do that. So these are all static images. Then we also do some video recordings. Nowadays, you can do even video simulations.
Yes.
So we do that for the record to see how the lips and teeth interact with each other.
Okay.
How's the patient's head position? How's the gait? All that we judge from that. So that first appointment in the photography area allows me to have a lot of information about the patient.
Do you do this to your all the patients or just the FMR patients?
No, not all the patients. We do it only for all patients who agree for treatment.
Agree.
So basically, once we have given them the pathway and we have given them the timelines, and
Yeah.
they have in principle agreed with the costing and with the time required, with the duration, then starts the first treatment appointment. So at that point, we schedule the patient for an hour and get
Yeah.
all the data done. So we do a CBCT, we do the photography, so we have the images as well as the radiographic data, and then we do the intraoral scans. So we have the entire digital data, and doesn't take much time.
Yeah, that's true. That doesn't take. But yes, this is actually something much require the photographs. It's for us to understand the visual about the patient.
Yes.
That's true. So you have done a lot of FMR cases now. If I don't know if we can count also or not.
It doesn't matter.
Yeah, but the question I want to ask here is that what's one of the lesson you have learned in all those FMR cases?
Oh, I'm constantly learning. So I think the most important number one lesson is that all cases are different.
Yeah.
And that there is no one formula which can be unfortunately applied to all the teeth. The concepts and the treatment plan remains the same, but every patient's reaction to the mock-up, to the way they will accept their smile, to the way they will accept their occlusion is different. And so we need to allow ourselves to customize our options to what the patient requires. A patient who comes from Ahmedabad or Surat who has severe pan eating habit, okay, has very unesthetic teeth for decades. He is not looking for aesthetic dentistry. He is looking for something else. So aesthetic dentistry is going to come for them, but they don't look in the mirror and approve anything.
Correct.
As compared to a 50-year-old lady who comes from a very well polished environment, and here she is looking at the mirror and is not worried about whether she can eat or not. She's just worried about how her teeth are going to look
Look.
in the end. So
Yeah.
every patient is different, although our core principles remain the same. But which core principle to focus on for that patient is the key learning point when you are interacting in the beginning. And the biggest interaction about the vision of your treatment with the patient happens when you do a mock-up.
Correct.
When they see it and when they go home and eat with it, your goal is to try and minimize the number of problems that they will have when they go back home. Like when they go back home and chew, they should be able to chew, not struggle with the teeth not meeting each other and having a problem with that. So knowing where the teeth belong on the face is aesthetic dentistry, but knowing how the teeth fit to with each other in a new bite is all about functional occlusion. And so that is where our strength lies, and we try to focus on that aspect for whichever patient that is more important.
Yeah, that's true. So if we have seen the challenge side and learning side, so there is some cases that always stay with you.
Yeah.
So is there any case that has stayed with you for the like till now?
Yeah, some of my first earlier cases. In fact, the first case that I did was of FMR I did was in GDC Bombay in 1996.
Okay.
So that was almost 30 years ago. And I did a full mouth rehab for him with one of the best labs at that time, Mr. Ajit Menon from Sai Dankala. And he did PFM restoration. That was the only material. Zirconia was not even invented. And Emax was not even produced at that time. So we used the PFM and we did the work. And that patient then, of course, it was my flagship case in my master's. So it was there on my album, and my examiners liked it and asked. So it was already a memorable case. But what made it more memorable was that after 18 years, in 2013, he located me on Google and found my practice. He was a government employee in GDC. So he found my practice and came to me. And when I saw my work after 18 years and the testimonial that he gave me a lot of confidence. And at that time, I realized that whatever I had saved, some of those teeth had broken over a period of time, and now we needed a rehabilitation again. So I did a second rehabilitation for him in 2013, and he still comes now to our practice. So I have a 13-year follow up of his second rehab after the 30-year follow-up of the first rehab. So that case is always my go-to case, because that was the first time a patient really agreed for all that I told him, and he also appreciated that over the decades.
Yes. He again came to you. That means you have gained the respect
Yes,
at that
and
time.
that gave me a lot of confidence in the work that we have done, and then allowed me to stick to the protocols which I'm following without doubting. Of course, the other cases memorable are the first ones who agree in your practice and are willing to pay you,
Yeah.
because now they are paying you for the work, and it takes you to a better level in your life and in your practice. So those are always there. For me, luckily, I document everything that I do. So I have got a good amount of database of work done right through the last 10 years, 15 years, 20 years. And it's good to see. Sometimes we imagine that some teeth in a patient may not really survive the long time. And we are telling the patient, why don't you extract all the tooth and do the implants?
Yeah.
And luckily, they didn't agree for it. They said, no, doctor, you save the teeth as long as possible. And now I'm seeing those teeth are still in function for 20 years.
Wow.
They're still there.
Wow.
So the patient's instincts were right.
Yeah.
And sometimes we as dentists assume that nature will not be kind to the teeth, because once the environment in the oral cavity changes, what you think may not last for a long time may outlive your expectations. So I always give the benefit of doubt to the patient, and even if it's a full arch implant case, and there are one or two teeth which I can save, I save it for the patient, because then psychologically they feel better and it works better, because those teeth are a part of your body. And when you lose your entire body part and replace it with something artificial, it's never the same as keeping at least a few teeth there, which are structurally strong enough, which are not mobile. Sometimes we keep saying that, okay, if this will come in the way, let's remove it. But when we save it, we see much better results with that.
Yeah, that's true.
Yeah.
And I where I practice right now, I've seen when my sir used to save those teeth, I've seen the smile they have कि चलो ये तो बच गया.
Yeah.
and they are happy
Yeah.
in that thing. So yes, I do agree with
Yeah.
this. So like I just need to ask that if there is one diagnostic thing that you rely on and you want that thing forever, so what it will be and why that?
Oh, tough call. So, uh, one of the tools which I really rely on in this digital world, which is an analog tool, is my articulating paper.
Oh, is it?
With the articulating paper, the way I can check and interpret the contacts, which I've honed the skills with my training at many places, at AACD, at the COIS Center over the years, allows me to diagnose simple things in a patient without any elaborate equipment. Of course, all the latest tools like the scanners and the CBCT, everything is an important part.
Yes.
But one thing which I would use in every single patient, in every single case, on every single day, is my articulating papers. And how I interpret those marks is something which we teach in our courses, which dentists don't really know which ones to use, where to use them, how to interpret the marks, how to make the patient make the movements so that the right marks come. There's so much science to it, and no digital data uh, or digital occlusal analysis has been able to come close to the information that the articulating paper can give you.
Wow.
Yeah.
I never thought about this that it will be this one. This one is surprising to me. I think to all the dentists out here will be surprised with this one.
Absolutely.
But when you explained, I understood the importance of it. So thank you for this tip. Actually, I would say. So as we have talked about what is one of the challenging, what stayed with you,
Yeah.
but there are some cases that make you the most humble.
Yeah.
Like sometimes we say ना उड़ रहा है
Yeah.
आसमान में, but there are some cases
Yeah.
that make you grounded.
Yeah.
So have you been in some cases like that? Like you have gone
Many times, many times there are. Nobody can fly high in the medical field, especially in dentistry, because
Yeah.
what will come back to literally bite you, you don't know. And so it's always better to do keep that in mind. But what helped me navigate those complexities or complications in practice is our system of doing a very thorough risk assessment with every patient. We don't jump into the treatment. We like to inform the patient about what is the risk of the treatment, and that risk could be the risk of breakage of a tooth on which I am doing a crown. The risk could be breakage of an implant or bone loss around an implant because of the existing periodontal conditions. That risk could be chipping of ceramic, which I would anticipate in a patient because of the various things that I see in their practice. So that makes a big difference, the risk assessment strategies that we follow. And that allows us to already tell the patient what is the red flag in your mouth, because of which what I will do for you will fail. It's not my lack of ability, it's your body which is going to change over a period of time. So if you are already diagnosed as a diabetic and now taking oral anti-diabetic agents for 10 years,
Yeah.
as your age progresses, you are going to see the changes of that in your body. And my implant is in your body, it's in your bone, in contact with your blood. So eventually, whatever systemic conditions you will face as you age, whether it could be menopausal age changes in women, it could be dementia related problems in men, it could be cancer related treatments which the patient might have to undergo because of future diagnosis. But that is what is risk assessment is about. It's about identifying what is it that can go wrong in a dentition. What is the reason because of which my restoration of teeth which I make for you will be lost. If I can pinpoint that with my experience in a patient, I've already mitigated that risk. The patient is already prepared that okay, this is short lived. My own teeth have become like this, and so I can understand after 10, 15 years if I have to redo the dentistry that I'm doing today. And that helps me lower their expectation. And when I am able to do that, their acceptance of future problems is better. So when the patient comes to us after 10, 15 years with something broken, they usually don't come to us say that, doc, you had done this and it's broken, now you take care of it. They usually come and tell me that you had told me that this will happen, and now I'm ready for the next step. You saved the tooth for 15 years, now let's do an implant.
Correct, correct. No,
So that
that's
is the
true.
important aspect. Yeah.
Yes, but as a young dentist and all out there, I need to ask that one thing, that when we explain this risk, many time patients say they get dicey कि अभी तो ये पेशेंट लाइक अगर ये प्रॉब्लम होनी है तो हम ये क्यों करवाएं.
तो मत कराओ, you don't do it.
Yeah.
So what is the risk of not doing the treatment? They have to be explained. Like we know that dental disease, once it inflicts you, is not going to treat itself, right?
Correct.
If you have attrition in your entire dentition and your entire enamel and half dentin is lost by not doing treatment, it's not going to come back.
Correct.
So don't do the treatment. Let nature take its toll.
Yeah.
And you right now, I will solve your chief complaint. If you have a wisdom tooth removal or a filling or a root canal, I'll do it. Okay, I'll do a crown also for you in that treated dentition and give you that. But now it's
Now it's
that
your
crown is now in a hostile environment because your dentition is hostile. So the crown I make for you would normally last 10-15 years for a patient, but may not even last 5 years for you. So you make the crown right now, you finish your existing chief complaint, I'll solve. But eventually you will lead a rehab. And so many patients sometimes don't agree with that plan. They say, okay, now we'll go back. Then they go to a local dentist, somebody does something for them. And I've had patients who have come to me after 5 years, 7 years, even 10 years after my first consultation with them. And they remember that I told them that their body part is completely destroyed. And then after that, many dentists told them that. And so they realized that we had made a diagnosis much earlier. And they come back and then they give us the time and the resources that we need to treat them well. And it's amazing how somebody remembers something which has been told to them about their body part.
Correct.
And so I always tell whoever is learning from us is that never hesitate in giving the right treatment plan to the patient. Don't worry about the cost of the time. That's not your job as a doctor. As a doctor, my job is to tell you what is wrong with you and what it needs, what correction has to be done to make it right.
Correct.
It's your job to accept or reject it, which both choices are there. And uh, some patients will accept, some patients will reject. You never know when dental treatment will become a priority in someone's life. So today, I might have a patient on the chair who needs a full mouth rehab, but the daughter is about to get married, husband is very unwell.
Yeah.
And after 5 years, daughter is gone, she's not coming back. She's in another country, she hardly sees her, and husband has passed away, let's say. And now you have time for yourself, and now you want to live your life correctly. And so you decide that now I will go and get this treatment done because I need it. And at that time, my priority was different.
Yes.
Today, this is the priority.
Yes.
And if you have never told that to the patient because you are scared that the patient might not be able to afford it, then you are denying them the opportunity to get their dentition in normal order just because of your preconceived notion that they might not be able to afford it.
Correct.
So, as an oral physician, as a diagnostician, as a dentist, your job is to tell the patient what needs to be done and not worry about how they will manage to do it. It's their problem. They will sort it out. Like if I go to a doctor and he looks at my blood work and he says, okay, your HbA1c is high. I need you to start taking medication.
Yes.
And I say, no, doctor, I will not take it. I will work on my lifestyle. I'll not take sugar. I anyway don't have a sweet tooth. I'll continue. So he said, okay, continue. Your body physiology will catch up 5 years down the line, 7 years down the line. At that time, you will have to start. It's not an emergency right now. These are elective procedures.
Correct.
You're not getting incapacitated because of not having that particular medication.
Correct.
Right? So it's all about that aspect.
So as you were talking, you mentioned first that you were almost to give up, and then Hawaii thing happened, and it changed you. But as in dentistry, I've seen it's never 100% result. It's always 96 or 95% result. So there can be some failure. So is there uh, anything that happened, like any failure that happens to you, but now in today's time you are grateful for that?
Yeah, so failures happen sometimes in your restorative treatment, sometimes in your surgical treatment. Sometimes the implant doesn't go exactly where you intend it to be. Sometimes the sinus gets perforated. Sometimes you're too close to the nerve, the next day patient has mild paresthesia. It happens. Earlier it used to happen maybe 15, 20 years and we were scared. But now we know that any surgical field, and dentistry is a surgical field completely,
Yes.
will have certain amount of complications which can happen even if you do everything right. This is not about doing wrong. Even if you do everything right, a wound may gape open. A patient may not follow an instruction. So complications are a part of your surgical treatment,
Yes.
and that is why informed consent is there to inform the patient that that can happen. And so the best thing to do is when that happens, not to panic.
Okay.
Find out why it has happened. See that it doesn't happen again next time in your practice if you can help it, and see how to manage the patient. What is the issue? Sometimes the patient has mild paresthesia, let's say, and your implant is touching the roof of the inferior alveolar canal. And of course, that was not an intention, it happened. And you see that the treatment protocol for that is to remove the implant. Don't keep it there. Because when you remove the implant, innovation will happen within a few months.
Correct.
So in that case, you will have to bear a loss of removing that implant. So remove that implant. Get that done. Let the patient is the priority. Their comfort, their ability to function well is the priority. These minor losses which happen in practice are something which happens everywhere. Every business has a small loss.
Yes.
You know, even if you have something as big as Reliance Industry, you know, you are might be subscribing to the Geo network, and then you might have hundreds of people complaining that I don't get any call.
Yeah.
There is a call drop, I can't hear.
Yeah.
So, however big you are, there will be somebody who will have some small problem, and that needs to be attended to. That's all. Your practice has to be geared towards healing with that.
As we have talked about the dentistry, I just want to talk about some of your mindset now. Like you have achieved so much, but still you are so focused, disciplined, and always hungry to improve yourself.
Yeah.
Why is that so?
I don't know. I just feel that I like to do everything as well as is possible. And if I was still doing dentistry today, what I did 20 years back, I think I would have been extremely bored. Because what is a dentist's life in the end? Just drilling, filling, same fights with the patient about the billing.
Yeah.
I didn't want to do that. I wanted to do something different. And I was fortunate enough that Bhakti, my wife, completely supported me in this aspect. Okay, we should try and hone our skills. And so over the years, she has also been learning on soft tissue procedures and sinus grafts. And now we've spent so much time on that we can really produce great results in that arena. And I feel that is the only way that will keep us going, because uh, I think dentistry we are blessed to be in a field where there is a little bit of artistry involved, a little bit of carpentry involved, a little bit of uh, finance management involved, a little bit of practice management. Because as you go from one aspect to the other, you realize that every few months, as the seasons turn, you need to focus on some other aspect. And when you are focused on that aspect, you have left it a little better than what it was before. And so, as you keep doing that in 5 years, 7 years time, you realize that overall your practice has become better. A patient comes to you not experiencing the same thing which he experiences to a dentist who might be really half-hearted in his approach, not spend any time on continuing education. So I think my greatest need and hunger for learning comes from the fact that I really love teaching. I have been doing that now since almost 30 years, since the time I passed. Immediately after passing, I had started some simple courses, and I realized that when I teach, it gives me a reason to document. When I document, I improve my work because I see the scratches which are otherwise not there. When my work improves, I get better ability to translate and how did we improve the work to our students. And so over the years, we have a tribe of almost 2,000 students who have trained with us on different aspects of full mouth rehabilitation, implant dentistry. And I enjoy that aspect of my life, because I feel that is the only time when I meet a lot of people. Otherwise, I would just be meeting patients who, with half their mouth open, are not even able to have a conversation with us. So my social aspects come from this teaching, and it just feeds each other. The need to teach fuels the hunger to learn. And luckily today we have the resources on social media, on YouTube, And there are so many wonderful clinicians out there who share their knowledge without holding back, not for money. They just share it for the passion. And I realize that if you have the knowledge and if you can pass it on, that's the best way, because our lives are short and we are not able to uh, going to have time to all of us make the same mistakes which our previous generation made. So the next generation has to outperform the existing generation, and that is the only way every field becomes better. And that's why in medicine, cardiology today is better than what it was 20 years back. Nephrology is better, neurology is better, so dentistry is also better. We have so much of AI and so much that is happening. It's such an exciting time to be in dentistry, and we feel that after 30 years also today we are still looking at uh, upgrading something, getting something new to the practice, either a skill set or a tool which will allow us to enjoy our day. Because a dentist spends almost 8 to 10 hours in an enclosed environment in his clinic, bending at abnormal angles, looking into a very microscopic substance, sometimes with very high magnification loops. So our fields are harsh, and the only way we can make it better is having a good mindset. When we enter the clinic, we should feel good that I want to come to this place. I want to spend 8 hours over here. And on most days, I spend more time in my clinic than actually awake at home, because half the time I'm sleeping at home because it's night. So I need to enjoy. So that's why we have designed a clinic also to have sort of a living room where you can go and sit. The patient can sit. You can have a coffee, just lounge a little bit in between patients. There is no need to have 20 patients in a day. It does not give you the same amount of satisfaction. Sometimes it's okay to have less patients to get more time in between patients or time with the patient to do something little extra, to do something little better. If you're doing scaling, do it also at such a level that when you look at a picture of that scale tooth, you see the teeth are looking translucent and beautiful, that there is no plaque left anywhere now available to be removed. So that is, every procedure needs 100%. And for that, we need to recharge. And as phones get old and their batteries get discharged faster, even as dentist gets old, their batteries discharge faster. We need more time to unwind. A weekend sometimes doesn't seem enough, and Monday morning has come and you have to start again. So the only way you can do this is by encouraging each other when we meet each other to do better, by not being cynical about our profession. And I hear so many young people complain that there is no work, there is so much saturation. There is not. There is not that much. There is lots of work, but you need to spend the years to train, and skill sets have to be upgraded. And once you do that, once you put in those hours and years, then it's good after that. It's not bad.
True. So, as you're told, it's really true. But to reach at this point, I think people always see the final outcome. But today, I really want to ask you that the struggle behind this, the sleepless nights, the family moments that you have missed. So, all of that was the part of the journey. So, how did you deal with that? How did you keep yourself motivated?
See, as a professional, you can't be there for everything everywhere. So if you want to give more time to your profession, some time from your family will have to go. Your family has to be supportive in that.
Yeah.
And the idea is not the quantity of time, the idea is the quality of time. So when you're with your family, when I go back home, I don't discuss dentistry at all with anyone. There are now 3 dentists in our house, but there is no dentistry, no patient, no complications discussed. Whatever it is, we finish before we reach home. And once we have finished that, we are planning our dinners and vacations and whatever it is. That is what keeps us going. And as time goes by in your profession, as you get busier, you will have a problem managing everything. And so that's why structure is required. So I don't have any problem taking a vacation for a month if I want to. I just have to plan it, block that time and go. That's it. There's nobody to stop us. We are the CEO of our practice. We are the owners. We can do what we want. And we are not the last dentist. So tomorrow, if you're absent from the clinic for 1 month, patient will find somebody else to take care of. And if you have really taken care of when they were with you, they will come back. They'll understand that You also need that time off. And so when my children were small, I spent a lot of time traveling with them, gaining experiences, creating memories which I think will keep me happy
Happy.
in the future when they will become old enough to have their own lives. We will have enough to look back, and we have had a good life in that regard. So creating a work life balance is never an equal balance. When you start, your work takes more prominence because you have to establish, you have to prove it to yourself first that you can do the
Yes.
work. You have to prove it to your family, you have to create value, you have to create that patient base. And then once that happens, then work is on autopilot. Then your family becomes more important. You're just getting married, your children are just getting born. You need to spend time with them. Your schools are starting, so you need to be there. So then you can equally divide the time. And then as time goes by, and when you become older, then you can decide where you want to be. Do you want to still continue working, or you have had enough and you want to do something else in life and live your life, see the beautiful world that is there? You don't want to work till your last day and die in the clinic. I hope that doesn't happen to me. So we want to have a holistic life.
Yeah.
That is our goal. And that is, luckily I've had good people who advise me the right way throughout my life. And even bhakti keeps us very much in line with the fun aspect of life, which otherwise I would have been consumed only by my work, which I don't want to be anymore.
Mm. So I have heard this that if your life is hard and if you want to see more harder, open your clinic. Why is that so? Okay.
So practice is opening our own practice is very hard. It's because you need the premises, you need the equipment, you need the patience. But every business is hard. No, if you look at a startup, when you look at somebody like the companies like Swiggy or Zepto, what did they start with?
Yeah.
They must also have had their doubts. They must have also had people who didn't want to provide funding to them. So we all go through that in the initial stages. It's all a struggle. The greatest musicians in the world were struggling whether their music will be loved or not. I listened to an interview of A.R. Rahman in which he said he was not sure whether he had the skill, but he was not sure whether he would be accepted. It's only after a few movies that he got the confidence. No, so it's always hard, and it doesn't stay hard. It becomes easier. It becomes better, and for that you have to create a passion for whatever you're doing, whatever work you're doing. And sometimes the passion doesn't come from within, so you can fake it. You can be energetic when you enter the clinic, be happy, say a little prayer for being grateful, and that it comes back, and you feel happier during the day. And eventually, initially in my practice, patients used to say, no, 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 I don't want to do this, I don't want to. Everything was no. I used to go back home very dejected. But now I don't have to work so hard. Patient comes only and says, I have come to you for this. So please do what is required. It took me 20 years to get there, and we are still not there. We're still uh, learning. We're still at some point trying to make ourselves better for our patients so that we can deliver something which will outlive them. We want our patients to outlive them after we have done the treatment, and that's our target. We're thinking 20 years, 30 years, 40 years down the line about how the patient's dentition will be. And so when we look at pediatric or orthodontic patients in our practice, I'm looking at their jaw growth and their disabilities at that point, and realizing that at this point we have such a beautiful power in our hand with orthodontics and with pediatric dentistry to make their life a much better life than what the previous generations had. So that power is something which we don't take lightly today. We are blessed that we are able to see that and change the trajectory of someone's life just by a small decision that we make on that day. So it's a gift.
Yes, that's true. So just one last question
Sure.
for today. What message do you want to give to all the dentists out there?
Just put your heads down, put in the number of hours and work hard, and find a good mentor or a series of mentors, and find a good philosophy. When you have these two align, then that should be your starting point in life, and it only makes it better.
Yes. Thank you so
Thank you.
much, sir, for this because this is gonna be really a highlight for everyone,
Sure.
especially listening from you. So thank you so much for today.
Thank
Thank
you.
you.
Thank you everyone for listening.
Bye.